We turn to Dr. Ramsey Hijazi. He's a prominent family doctor in Ottawa. Earlier this week, he announced he was burnt out and leaving his practice. Thanks for joining us today, Dr. Hijazi.
Yeah, thanks for having me.
So can you tell us just about how you came to this difficult decision?
Yeah, and it was definitely not a decision I made lightly, and it was really not an easy decision to make. You train, half your life and spend all those countless hours studying and, spend hundreds of thousands of dollars to do this training, and then you decide to leave it all. So it was not at all a decision I made lightly, but really it boils down to the two main issues that are driving the crisis in family medicine right now, which is the administrative burden, which, on average is 20 hours a week of administrative work. It's just mountains and mountains of paperwork that just burn you out. As well as, the funding that OHIP gives us to run our clinics is just really not kept up. So we run small businesses and, every year and there's inflation and rising costs. And so our clinics are losing money year after year after year. And so, at the end of the year, when the clinic has the budget and there's a shortfall, we have to put our own personal money into the budget to keep the lights on, to keep the staff paid. And that happens year over year. We lose more and more money. And so, it's draining, we're burnt out. And on top of that, we're running a failing business. And so, you take all that together, it's a recipe for disaster for people to leave.
I think when we hear about doctors struggling financially, I think that raises a lot of eyebrows for people who maybe have thought historically doctors are doing quite well financially. Can you break down exactly how that is working out for you financially and how much more would be needed in order to be able to make this a more successful business model?
Yeah, sure. And I would like to comment on that specifically. So I think it's not necessarily that, we are, I think historically there's a lot of stigma that, family doctors are absolutely rich and we make tons of money, which, is absolutely not the case. Now, having said that, there's, I won't lie and say that we don't do better than a lot of the population. Certainly we do. But what I'm talking about specifically is you are running a business and every year the business loses money. So every year you need to take more and more of your personal income and dump it into the business. And so year over year over year, your take home is decreasing every single year. I've been in practice for 10 years. Over the last 10 years, every single year we lose more and more money and you're continually dumping more and more of your money into it. So, when does it stop? It's been 10 years and nothing has improved.
Yeah, and with inflation as well. Now, you founded the Ontario Union of Family Physicians to try and raise awareness and try and push for changes to the way that family medicine is organized and compensated. What are members telling you? Because I understand it was quite successful. A lot of people joined this group. What are members telling you about their concerns about family medicine and what needs to be done?
Yeah, so I started the Ontario Union of Family Physicians in July of last summer, and since then we have over 1,800 family physician members in our group, and it's been spread mainly by word of mouth and online through forums. But I think there's many issues, but a lot of them are echoing the same concerns, and really the number one and two biggest concerns are the paperwork load. Like I said, that's 20 hours a week, which is often done on weekends or evenings because we don't have time to do it during our clinical hours. So that's half a full-time job you are doing after hours and on weekends. And I understand all jobs have paperwork, but to do half a full-time job on the evenings and weekends and it's completely uncompensated, unpaid, that really leads to a lot of burnout. And I think everyone more and more is identifying the financial constraints of running the business. So the only way family medicine clinics stay alive is by family physicians personally funding the clinic and the small business. And in no other industry would that be considered a sane decision to continually dump your own money into a failing business. It just doesn't make sense.
Now, you aren't leaving medicine altogether, we should clarify. Can you tell us about where you're going and why you decided to move to that position?
Yeah, so I'm going to be moving to a hospital position where I will be taking care of patients who are in hospital a little bit more chronically and for rehab and things like that. And so how it differs primarily is that, I'm not involved in running a small business. I don't have to pay staff. I don't have to hire I don't have to hire and retrain staff all the time, which is happening in family medicine all the time now. There's none of those stressors. I don't have to worry about the financials of the small business. And the second component is, there really isn't all that paperwork involved. Like I said, every job has some paperwork, and there's a little bit, but it's not by no means even, on the same order of magnitude.
Now, yesterday we spoke with the president of the Ontario Medical Association about some of the money that's been given, about the Ontario government pitching in some money. We know the federal government has come to the table with a deal with Ontario to try and make the situation better. The president said that he does think this is going to make a change. What do you think?
So actually, I'm glad you asked me that question because I totally disagree. I think this funding is not going to make much of a difference at all. I think most of this funding has been earmarked for expanding team-based care, and I work in a team-based care model, and I can say it's also it's a failing business. And the fact of the matter is we have more family doctors in Ontario than ever before. The reason why we have a shortage is because family doctors who are trained in family medicine are not practicing family medicine and are leaving. So, adding more money to create more team-based care locations doesn't take away the fact that those businesses are also failing. And so to me, it doesn't make any sense at all. What we need to do is we need to incentivize family medicine so that all the doctors who are not practicing family medicine come back to family medicine, or those who are considering leaving don't leave. That's fundamentally what's going to make the difference.
Dr. Ramsey Hijazi, thank you for giving us a view of the struggles for family doctors on the ground. We're glad you're not leaving medicine completely, and glad to hear that your patients as well have also found other doctors to take care of them. Appreciate you joining us today.
Yeah, thank you very much.